This is media briefing number 9 on the status of coronavirus in Mandera County. This is our continued update on COVID-19 in our county. I would like to take this early opportunity to wish you all a happy Labor Day. On the 29th of April 2020, we tested a total of 27 people for COVID-19 from Mandera County. 9 of the persons were from the quarantine people in Elwak. 11 persons are from quarantine people in Ramo. 1 person is from the quarantine people at KMTC Mandera town. And 6 are the positive cases undergoing treatment at the isolation ward in Mandera County Referral Hospital. We are relieved to report that all the persons in various quarantine facilities at Elwak, Ramo, KMTC Mandera have tested negative for COVID-19 and have accordingly been released. Of the 8 COVID-19 cases tested from the isolation ward, 1 has completely recovered from COVID-19 after 2 tests were carried out and therefore has been released from the isolation ward in Mandera County Referral Hospital. 2 others who are initially positive have also recovered and have now tested negative, awaiting for a second test to further validate the first test before we release them from the isolation ward. The 5 remaining patients at our isolation ward are progressing very well, and we are optimistic, inshallah, very soon they will also recover. We have so far tested 24 frontline health personnel, and alhamdulillah, they have all shown negative test results. This has increased the confidence level for our medical personnel who are attending to COVID-19 patients safely. We are giving our health personnel all the necessary support, including protective equipment, to support the execution of their responsibilities safely and effectively. We have so far tested a total of 134 people, despite our long distance from the nearest testing facility, which is 1,200 kilometers in Nairobi. We still have a few more people in quarantine within the county to test. I therefore wish to request the Ministry of Health to send us a flight to carry the samples of these cases for timely testing. We have grave concerns about the unfolding COVID-19 situation in Somalia and its potential to spill over into our region. We appeal to the non-state actors to provide support to our neighboring towns of Bulahawa and Elwak, Somalia, as urgently as possible. Coronavirus is a global challenge without borders, hence require concerted efforts by all to mitigate its severity through supporting one another. Unfortunately, we have no capacity at Mandera County level to help our neighbors as we used to support them during outbreaks of other pandemics. Because this pandemic is affecting everybody at the same time, we urge our public to avoid cross-border movement during the period of this pandemic. We are likely to have a lot of false alarms arising from fevers, which is as a result of mosquitoes during this rainy season. We urge you to come to the hospital for testing without being alarmed. Recently, we carried out an assessment on the population to identify vulnerable families requiring relief food support. The assessment identified 86,000 households requiring support. However, we further categorized in terms of the degree of vulnerability and identified 43,000 households as those requiring urgent attention. We determined that out of the 43,000 households, 10,000 households are at risk of starvation. On the 29th of April, we have distributed 693,000 metric tons of assorted relief food to the initial 10,000 households we identified as the most vulnerable in our society at risk of starvation. We appreciate immensely the support of COCOP, who are the local partners of World Food Program in Mandera County, for the support they have given us through the distribution of an additional 450 metric tons of assorted food to 7,000 households in 3 sub-counties of Mandera North, Mandera West, and Banisa. We appeal to WFP to consider adding the remaining 4 sub-counties of Mandera East, Lafe, Mandera South, and Kutulo sub-counties, who have the same vulnerability index as the 3 they are supporting. Finally, as we register some improvements in our situation, we must continue with the measures required to fight the spread of coronavirus in our country and in our county. Even when you test negative, assume you have it. This is what experts have advised us. Please continue practicing social distancing. Wash your hands with soap regularly. Cover your mouth and nose with mask or improvised clothes. Covering your mouth